is one of the pioneers in not only new methodologies in psychiatric treatments, but specifically in TMS. Since 2000, he has treated more than 1,000 patients in America and is an expert himself, very respected expert. So when we were talking, he said, Pavan, you should look at this new revolutionary treatment. ये treatment अमेरिका में अभी 5 से 10 साल से use कर रहे हैं. Different parts of the world also they are using now. And insurance companies भी cover कर रहे हैं इस treatment को. So it is very approved, very recognized and credible treatment. तो मैंने सोचा, why don't we start this in India? Usually when a new technology comes in America or any other part of the world, वो 8 से 10 साल लगता है इंडिया को आने में, especially if it's an expensive treatment. So we said, why don't we initiate it at the same time when it is growing in the rest of the world? So we decided to set up this wonderful initiative to get what we call TMS, transcranial magnetic stimulation, that is the treatment, to India along with the rest of the world. You know, one of the first times that a new technology is being launched simultaneously in India and rest of the world. So we are very proud to be part of that. And if you look at India itself, the research, like we were playing the slides before, 1 in 4 adults in India have depression. You know, हमारे यहाँ there's more than 600 million, 700 million adults. And what that means is more than 100 million adults experience depression sometime or the other in their lives. And depression and mental illness, India mein to, you know, it's a stigma, there's a taboo attached to it. A lot of people don't come out in the open and say, mere ko kuch ho raha hai. I don't know what it is, because mental health bole to mental hospital jao bolenge. So we said we will create a center that is not typical of a mental hospital or a psychiatric hospital, but a more homely environment where people can come in, feel comfortable and undergo this wonderful treatment. So, you know, I welcome many of you all to visit our center in Greater Kailash. When you walk in there, you feel a very homely, feeling. Or हमारे psychologists and technicians and we've trained them in such a way that they treat people with a lot of love and care. This is the most important thing for successful treatment. TMS वाला machine होएगा, लेकिन अच्छी तरह से to treat them well and to make them come back again and again is very important. So our culture, the way we treat patients, the way we take care of them with love, and the clinical expertise that we have developed in our centers is what will make us successful. As far as future is concerned, we are very ambitious. बहुत बड़े plans हैं हमारे. We are starting centers in USA, in Europe, in UAE and in India. India mein we are starting with Delhi because we believe Delhi is a wonderful place. AIMS bhi hai, they have encouraged us a lot. So the larger institutions are behind us and we are very lucky to have that. And we'll start with the metros. We are planning to start in Bangalore and Bombay and other metros. Then we will move to tier 1 and tier 2 cities. For all of these smaller cities, we have different models where we can price in different ways and different packages can be offered. So we are very excited to embark on this journey. We believe that we will revolutionize mental health, brain disease treatment in India and the world. So very glad, and I thank you once again for being here. Thank you and welcome. I want to pass on the mic to Dr. Murali to talk more about TMS.
Please welcome Dr. Murali Rao.
Thank you very much. Thank you. Welcome you all. I'm really excited that this is happening in India, and Pavan's efforts have finally come to fruition today, and it will grow because we have an immense need, because depression is such a common problem. It cannot be just put down as mental. It's not any kind of craziness. It's just the person's emotions and mood disorders. So that's been taken out of rest of the psychiatry. And we traditionally, as you know, had only 2 forms of treatment: psychotherapy or medications. And we never had any other options. We had no other options. So now we have a third option that the clinicians can offer for their patients, whether they be psychologists, social workers, psychiatrists, primary care doctors, whoever are treating with depressed patients. They can, those who have not responded to 1 or 2 trials of medications, because only about 1/3 of the patients who take antidepressant medications respond to the treatment. Other 2/3 may show slight improvement, but they don't recover well enough to go back to their normal life. So this can be an add-on treatment, and they will continue to get a wholesome treatment consisting of psychotherapy, like Mr. Pavan was saying. It will be in an environment that's very conducive and very supportive of a depressed individual. They'll be specially taken care of, and this process, it's a 4 to 6 weeks process. The treatment consists of, it's a method of focusing magnetic waves. The power and strength of the magnetic waves is same as in an MRI scanner, but here it's delivered in a very focused way to the part of the brain, to the networks of the brain. Brain consists of 1 billion neurons, and each neuron makes about 10 million connections. It's a very complicated connective system. So there are a number of connection systems, and particular connection systems, when they are in a disrupted way, it can cause different problems such as depression, such as obsessive compulsive disorder, anxiety disorders, addictions. So the having the state-of-the-art of equipment to focus the magnetic waves to the different regions of the brain and deliver the pulses, which is you don't need anesthesia, it's painless. There's a slight discomfort only during the treatment. There is no medication necessary before and after the treatment. Patient can walk in and walk out. There is no need for somebody to bring them in and bring them out. So it's a convenient treatment now available in addition to psychotherapy and medications. So at least for the first time, psychiatrists have this revolutionary method of helping about 2/3 of patients who don't respond to traditional treatments. So at least we can help. There's no guarantee everybody will be helped, but at least we have a third option to improve further so that they become functional and back to the society. The loss to the family and to the society is never measured. In addition to individual suffering, the family suffers a lot. It causes a lot of disruptions in life, in terms of relationships, in terms of employment. So the 256 million people in India suffering, I'm not talking about every day what we call as today I'm feeling a little down. That's not what we're talking about. We're talking about major depression. Depression that stays on and on and on for 15 days or longer. So that's only when we make the diagnosis of major depression. For such depression, the treatment is necessary because it's very much like a chronic disease like diabetes or hypertension. Just like in hypertension, you give one medication, the second medication. Here, after one medication failure, the second, third medication doesn't produce as many results. So that's the time we have to introduce TMS into the treatment to get them to a higher level of functioning. And only about 10% of those patients who receive treatment will need maintenance treatment. Others, it's like a complete change of life. It's like a new chapter has opened up, and we have seen that, and that's how I believe that. That's how I convinced Mr. Pavan about that, and I'm glad it's happening. And I hope when it becomes a common word, everybody knows that. I'm glad to see the number of press being here. I think we should do a lot about depression because it's a big problem. And India, particularly according to WHO estimates, is going to have further increases in depression in the coming next 5 to 10 years. So we have to address this problem. So this is one of the approaches, and we are very glad to be part of that.